Hello everyone, I am Dr. Rajita, faculty of Next Fellow. So today we are going to discuss axilla and brachial plexus, which are very important for your exams. So axilla, otherwise called as armpit in lay term, which is a triangular depression bounded by anterior and posterior axillary folds. So here this is the anterior axillary fold, posterior axillary fold. The triangular depression is the axilla. So axilla is like a gateway for all the neurovascular structures which supply the upper limb, pass from the neck into the upper limb to via the axilla. And there are several lymph nodes which are called axillary lymph nodes, which are clinically important, located in the axilla. So boundaries of axilla, it has got the anterior boundary, posterior boundary. The base, yellow one is the base, the medial wall of axilla, and the blue one is the lateral wall of axilla. And above is the apex of the axilla, which is like a truncated cone, and apex itself is triangular in cross section, and apex is otherwise called as cervico-axillary canal because many structures enter from the neck into the axilla, that is the brachial plexus and axillary artery entered through this cervico-axillary canal, and axillary vein from the upper limb passes through the cervico-axillary canal, that is the apex of the axilla. So cervico-axillary canal is like a gateway into the axilla. So medial boundary, here we can appreciate the ribs. So upper 4 to 5 ribs along with the intercostal spaces, and laterally we can see the neck and part of the shaft of the humerus, and apex here anteriorly we can see the clavicle and posteriorly the scapula, and medially the first rib. So in a dissected specimen, anterior wall is majorly formed by the pectoralis major muscle. So anterior axillary fold is formed by pectoralis major. So this is the sternal head of pectoralis major, clavicular head of pectoralis major. And what you are seeing, this is the deltopectoral groove, and here is the deltoid muscle. So anterior axillary fold is majorly formed by pectoralis major muscle. Posterior axillary fold is formed by latissimus dorsi. We can see here latissimus dorsi along with the trapezius and subscapularis muscle. Deeper here is the subscapularis muscle. And medial wall, we can appreciate the serratus anterior muscle. This is serratus anterior, digitations of serratus anterior muscle. If we remove the serratus anterior muscle, we can see the intercostal ribs, that is intercostal spaces containing intercostal muscles and ribs, which forms the medial wall of axilla. And laterally we can appreciate a part of biceps muscle, short head of biceps, actually short head of biceps, coracobrachialis, and long head of tendon of biceps. All these structures will form the lateral boundary of axilla. And if we remove the anterior wall pectoralis major, here it is reflected to expose partially the contents of the axilla. The red one is the axillary artery, blue one is the axillary vein, and yellow color structures are the brachial plexus which are present in the axilla. And we can see the cervico-axillary canal as well, through which the structures are entering into the axilla. So the contents of the axilla, it contains the brachial plexus, which are the cords and branches of brachial plexus, axillary artery. Here is the axillary artery, which is surrounded by the brachial plexus, and the medial relation. Always in the axilla, the medial most structure is the axillary vein. So we can see the cut end of axillary veins. So brachial plexus, axillary artery, axillary vein, axillary lymph nodes, axillary pad of fat, and loose areolar tissue. These are the contents. The neurovascular structures are enclosed in the connective tissue sheath called as axillary sheath. Here is the schematic image showing the cross section of the axilla. So this is the lateral side where we can appreciate the shaft of the humerus. Medially the first rib, which is covered by the serratus anterior muscle, and posteriorly the thin bone, which is the scapula, This is the medial end of the scapula, where we can see the insertion of serratus anterior to the medial border of the scapula. And within the concavity, subscapularis muscle is there. And anterior wall of axilla, we can see the pectoralis major and minor, which is present partially here, pectoralis minor. And within this groove, this is the bicipital groove containing the long head of biceps, and short head of biceps and coracobrachialis both together forms a conjoint tendon. So all these are medial wall, and posterior wall is formed by subscapularis, teres major and latissimus dorsi. Teres major and latissimus dorsi are inserting into the bicipital groove or intertubercular sulcus of humerus. And here is the neurovascular bundle. The medial most will be always axillary vein, then artery associated with the brachial plexus. So here is a cadaveric image to demonstrate the similar structure. So now we can have an idea. This is the anterior side of axilla, this is the posterior side. The cross section is taken. This is the lateral side, we can see because of humerus, and here is the deltoid muscle covering the humerus, and the thin bone here is the scapula. This thin white line is the scapula. Posteriorly, the scapular muscles makes the major bulk on the posterior side. So this is the subscapularis muscle, and dorsal to the scapula, this is infraspinatus muscle. And we can see here, this is the axillary vein, axillary artery, and along with the cords and branches of brachial plexus. This white color thing is the axillary pad of fat, and this is the pectoralis major, and here is the pectoralis minor. So the anterior wall of axilla is thin compared to the posterior wall, and medial wall is formed by the rib covered by serratus anterior. So this is the medial wall of axilla. What is this muscle? This is pectoralis major muscle, which forms the anterior wall of axilla, and this is the pectoralis minor muscle. This is axillary artery. I hope you all know that.